Hello students, here is Deepika Pathak. Today I am here to discuss about medication adherence, why medication adherence is important, how to calculate it and what are the factors related with the medication adherence. What are the reasons why the patient follow the non-adherence. So, let us start. Yes, coming to the definition of the medication adherence, it is the extent to which a patient medication taking behavior coincides with the intention of the health advice he or she has been given. Means it is related with the conformance of a patient with the physician order. Now, it is important factor for determining therapeutic outcomes, especially in the patient who are chronic, who are in a comorbid situation. Means a patient is suffering from a diabetes and also the patient is suffering from a hypertension or any other condition. So, in that scenario, it becomes very important to know about the adherence of the patient, how much percentage the patient is following with the prescription order. Now, there are some of the data which is related with the World Health Organization, what the WHO is saying. Medication adherence can have a more direct impact on patients' outcomes than the specific treatment itself. Means individualizing a patient therapies is important part, but also we have to know about how the patient is conforming with the physician's order. Means the patient is conforming with 80%, 90% or 100% of the physician's order. So, that is a very important part here we have to note. Medication adherence can affect the quality and the length of the life and health outcomes and overall healthcare cost. Of course, if the patient is following the treatment what the physician has prescribed, the quality of the treatment will improve. Also, the length of the therapy, the length of the life the patient is facing in a particular disease will also improved and health outcomes will increase, especially if I am taking an example of any disease such as the hypertension or diabetes. Patient is taking the therapy as what is prescribed in the physician's order. Of course, health outcomes will be improved, especially healthcare cost. Just I am taking an example here. What happens if a patient is taking a therapy, the physician has written order for the 10 days and the patient is taking, what will happen? The patient condition will improve and it will take the time as it should take. So, a particular disease has to treat in a 30 days. Of course, it will treat in a 30 days if the patient is following the physician order. So, ultimately the cost will be as the physician recommends, and if the patient is not following the physician's order, means the patient is following the non-adherence. There are many reasons, it could be intentional, it could be unintentional, we will do it later, but the cost will be high because there may be the chances of the rehospitalization, there may be the chances of the adverse drug reaction, there may be the chances of the withdrawal symptoms after stopping a particular treatment. So, there are many reasons related with the non-adherence, we will do it later. Non-adherence can account for up to 50% of the treatment failures. What happens? Sometimes the patient is not following the physician's order, the prescription, and then there are the 50% chances of treatment failure. This is the data which is presented by the WHO. And also we can see there are the deaths. Why there are the deaths? Of course, just because of the withdrawal symptoms, there are the adverse drug reactions, there are the side effects, the patient seen with the toxicity. These all are the reasons for deaths. And of course, there are the chances of the rehospitalizations. Now, coming to the next, Now question arises, why it is needed, why medication adherence is needed. See, first is a replacement therapy. Sometimes what happens when the patient is deficient in any of the hormone, any of the protein, any of the enzyme, what we are giving a treatment as a replacement therapy. We are giving hormone from outside, we are giving as formulations such as which we are preparing and we are giving to the particular patient. So, it is very needed at that time. Replacement therapy. Point number 2, maintenance of pharmacological effect. Yes, we want, if a patient is suffering from a hypertension, diabetes, we want to maintain the pharmacological effect, means to stabilize BP as in a condition of hypertension, to maintain or to stabilize the blood glucose level in the condition of diabetes. So, to maintain the pharmacological effect, it is very important to adhere with the therapy. Yes. Now, maintenance of serum drug concentration. Of course, when there is a balance in the concentration which actually body wants, ultimately pharmacological effect will be seen. Now, some diseases of public health importance, especially TB, tuberculosis. There are many chronic diseases such as hypertension, such as diabetes. What happened? There is a chronic therapy. We have to maintain the therapy. So, at that time it is very important to maintain the adherence. So, some diseases of public health importance where non-adherence is a major obstacle, where the patient are not following the therapy as they should be. In chronic diseases, I told you, such as diabetes and hypertension, and if the patient is suffering from any comorbid situation, such as the patient is suffering diabetes with a hypertension, diabetes with a neurological condition with a gastroenterological condition. So, these all the conditions we have to note. At that time, adherence become very, very important. Now, these are the needs for the medication adherence. Now, the question comes in our mind, like what are the reasons, what are the causes for non-adherence, why the patient are not taking the prescription as they should to. So, categorized on the basis of whether the prescription was honored. Yeah, so the reason is prescription was honored, how the prescription is honored. Now, medication was overused, maybe sometimes medication was overused, maybe sometimes the medication was underused, or whether the non-prescription medicines are used, like OTC medications we have taken, OTC medication, herbal preparation, supplements. So, these all are the reasons, and by, let us see, number 1 primary and number 2 is the secondary. What happened in the primary reasons, we can see when the prescriptions are not dispensed as they are prescribed. This is the primary reason. Secondary reason could be intentional or unintentional. Intentional means patient very well know that patient is not following the prescription. Why it happens? See, there is sometimes fear of adverse drug reaction. Patient in their mind, there is a thought, there is a fear of adverse events or negative attitude towards the prescription, towards the medication. Just I am taking an example here for the intentional. What happens if a physician writes a prescription with 2 of the antibiotic for, I can take an example of a flu or any viral infection to patient, what happens, and the therapy is for, let it be 5 days. What happened? Patient had taken it for 1 day, for 2nd day, and it is relieving. And the disease is in a cure situation. When the symptoms are cured, what patient will do? Patient will not take the medication from another day. So, this is the attitude of how the patient are taking their medications, how the patient are taking their prescriptions. This is called as beliefs, this is called as attitude towards the prescription, towards the treatment. So, this you call it an intentional reason, yeah. Another is the unintentional, means the patient is not aware about the patient, actually the patient is following the prescription or not. Why it happens? Of course, the patient forgets to take it, yes, patient forgetfulness, patient memory loss, yeah, patient is in confusion. So, these are the reasons, and these reasons generally happens due to the age or any neurological disease, yes, neurological diseases. So, these are the reasons, and there are another reasons also. Sometimes the complexity of the prescription, number of frequency, the number of medications, these are sometimes there are the cost reasons. The medications are very costly, patients are not able to take all these medications. Then non-adherence arises, and we have to avoid these of the reasons to improve a particular therapy, to make a particular treatment successful. Now, coming to the determinants of medication adherence. What are the factors which will improve the medication adherence? Now, coming to this slide, the situation is almost unique because every patient is different in itself. So, the factors are different. Let us see. Number 1, predisposing factors. Number 2, enabling factors. Number 3, reinforcing factors. What do you mean by these factors? We will do one by one. Predisposing factors means demographic factors, yes, patient knowledge, attitudes, beliefs, perception, etc. I told you the patient has a negative belief about the treatment. The patient is if the physician writes a particular prescription for 10 days, 15 days and patient had to follow, but what the patient did? Patient just took for 2 days, for 3 days just to improve the symptoms. When the symptoms improve after 2-3 days, patient skipped that treatment, yes. So, this is called as a belief, this is called as an attitude, and perceptions also. Sometimes a patient has a fear about side effects, about adverse effects. Now, another factor is the enabling factors. Enabling factors means the motivating factors. What are the motivating factors? We come up with the data here. Skills such as to take appointment. If the patient is taking appointment, resources means healthcare facilities. If there are the proper healthcare facilities for the follow up, for the patient counseling, of course, the patient will follow adherence. Another are reinforcing factors. So, what do you mean by the reinforcing factors? Let us see, here is adherence which is supported by family members, means there are the other members who are motivating towards to follow the adherence, means it could be family members, it could be peers, it could be health care providers, they are motivating, the pharmacists, nurses, they are motivating for following the adherence, they are monitoring the treatment, local community, society. So, these all are the reinforcing factors. Now, there are another determinants which will tell about the medication adherence, and what are these factors, these determinants. Let us see, number of medicines and frequency of dosing. It comes under the complexity of prescriptions. What do you mean by the complexity of prescriptions? As for the comorbid patients, what happens in the prescription? There are number of medication. So, what happens if we will tell to a patient to take one medication a day? Of course, patient will take, but in another scenario, what happens if we will say to take 10 tablets, to take 5 tablets in a day? Of course, the patient will skip. It could be intentionally or unintentionally. So, number of medication is also one of the determinant here. Fewer the medication, of course, I told you, जितने कम medications होंगे, of course, better the adherence उतना अच्छा होगा. Now, coming to the frequency of dosing, yes. So, If I tell to a patient, or if I write a prescription with 1 tablet or a 2 tablet, means number of times the patient had to take. Frequency of dosing means OD, or BD, how many times the patient had to take it. So, once daily administration expected to have better adherence. If I will tell to the patient to take 3 medications 3 times a day, and in another scenario if I tell to the patient to take 1 medication in a 1 day, of course the second one is showing the better adherence, that the chances to skip the dose is less. Now, coming to the medication adherence in relate with a pharmacist. So, how the pharmacist, what is the role of the pharmacist in medication adherence? Let us see. Number 1, whatever the prescription the physician writes, it should be dispensed in a same manner, and this is the responsibility of a pharmacist. So, dispensing medication, this is number 1, we have to dispense in a to a right patient, right dose, right quantity, right frequency, for right disease. These all things we have to note while dispensing the medication, right formulation. These all points we will consider at the time of dispensing medication. As a pharmacist, take accounts of spiritual and psychological needs of patient. We have to know the beliefs of the patient. If the patient has a negative attitude towards the medication, what we can do is we can give the patient counseling. Yes, we can give the patient counseling to a patient, so that patient is aware about why it is important to take the medication. Okay. Now, point number 3, improve patient education. I told you why we want to know the spiritual and psychological needs of the patient related with the disease, related with the treatment. So, ultimately when we get this data, of course we will improve the patient education. Encourage patients to discuss their main concerns regarding treatment. Yes, of course, while dealing with the patient, while dispensing the drugs, while dispensing the medication to patient, what we want that patient should ask the queries. So, the main concerns actually about the formulation, about the side effects, about the treatment, patient can ask anything regarding the treatment to the pharmacist. So, this much at least we can do while giving the patient counseling to patient. Now, giving clear explanations, this is also important part, and after giving the clear explanations, we have to know that the patient is actually understanding what pharmacists want to tell. So, giving clear explanation about the treatment, what are the medications, what are the dosing, about the quantity, how many times the patient has to take the medication, means the frequency, and there are some drugs, there are some medications which are causing little of side effects like sedation. Sometimes the patient can feel sedation, there could be GIT upset. So, it is very important to tell to patient while discussing with the treatment at the time of while we are discussing with the treatment, is very important to tell about all these side effects, so that the patient is aware about this. Now, check patient understanding. I told you it is very important, we are discussing the treatment with the patient. So, we have to know how much the patient understands, and there are many modes we can use here. One is a visual. We can use visual charts. Sometimes the patient is not understanding the language we are telling. So, we can use the visual charts, like in the charts we can show these 2 tablets you have to take for 2 days, for the 1 day. So, like this. Now, check the patient attention to medication adherence, and we have to know, this is called this we are calling as patient beliefs, that how patient is attentive for the medication adherence. There are many methods by which we can know the medication adherence. We will do it later. Simplify the therapeutic regimen. So, we have to simplify, either by dispensing the formulations we can see, and of course there are 2 and 3 tablets. If it is given for a particular treatment, we can try for single formulation, a combinational formulation. So either we can dispense or by just consulting with a physician, or we can report it to the physicians also. Be aware of patient wishes, like patient wants a particular flavor, it could be the chocolate or vanilla for a particular formulations like syrup, so we can recommend that or we can dispense it. So be aware about the patient wishes. Now coming to involve the patient in treatment decision. Yes, it is very important that patient should be involved in the treatment decisions. Like if there are 2 and 3 options for a particular treatment, like for diabetes there are 2 and 3 options, one could be the with a combination of 2-3 drugs, and another is with a one drug for a longer time. So at least we can tell to the patient, and patient is aware about the treatment options. Improve home support. Okay, so it's like home support means the patient can give the counseling at any time when the patient wants, and patient had any query in their mind, so they can ask to the physician and pharmacist both. Monitor beneficial effects means like if a prescription is prescribed for a particular disease like hypertension, I am taking example here. So beneficial effect means to stabilize BP, means the BP is normal. So these are the beneficial effects. When the patient will come again to a pharmacy or to the hospital, what the next step pharmacist will do is to monitor BP or monitor diabetes in the respective cases. Monitor side effects. If any side effects are occurring to the patient, of course we have to monitor them, and if it is required to change the therapy, it is recommended either by reporting to the physician first or by changing a therapy. Now provide long term support to the patient and continuity of a care, and it is very important while dealing with the adherence. It is very important to support the patient when the patient is in a chronic therapy and to maintain the continuity of care. So these are some of the points the pharmacist can do to maintain the medication adherence. Now monitoring of a patient medication adherence. How we can monitor it, how we can calculate it. So see, there are some of the method. One is the direct objective, second is indirect objective, third is health outcome measures, 4 is utilization of healthcare service, 5th is indirect subjective. What do you mean by these methods? Let us see here. Direct objective, what will do it here? Measure blood and urine levels of drugs. Yes, direct objective means we will see the levels of drug in the body, present in the body. So measure, we will take the sample of blood, we will take the urine samples and we will check the levels of drugs, or we can check the any markers, like some of the drugs are influencing the level of the enzymes, the level of the proteins, and these levels of the enzymes or proteins are changing and they are giving the pharmacological action. So we can either check the level of markers, any enzymes, any proteins, or we can check directly the levels of drugs in the blood or urine sample. This is called the direct method. Now indirect method, indirect objective method means we are checking the adherence in indirect way, means we can check number of pills, okay, we can check the number of pills or prescription refilling, when the patient will come again for refilling the prescription generally at the follow up time. So what we will check, we will check the numbers of pills, number of capsules, tablets, these all things. Electronic medication containers, they are giving the they are giving the data which is in update form. So directly we can check from the electronic medication containers. Electronic medication containers ke through we will check number of pills present in that container, number of capsules present in that container. So this is also one of the method by counting the number of pills. Another is the health health outcome measures. So, this is a method, we call it as a consequences or outcomes. Whatever the outcomes are coming, on that basis will decide the patient is following a particular therapy or not. So, blood pressure control, if the patient is taking a particular therapy for a hypertension, so of course it should stabilize the BP, it should control the BP, so blood pressure control. Or asthma severity, means if patient is taking a particular drug for the asthma treatment, so it is improving the asthma. And of course, if the patient is taking a particular treatment such as like for cancer, the diseases which are very severe like cancer, so a particular therapy will improve the survival rate, it will reduce the hospitalization. So, in that way we will calculate the health outcome measures, and on that measures we will see the patient is following the medication adherence or not. Now, the another utilization of healthcare services. This is the method in which we will calculate, we will see how patient is attentive for its treatment. How patient is attentive for its treatment means clinical attendance, how much the patient is coming to a hospital, how much appointments the patient is taking or making or keeping, preventive visits, how many times the patient is coming for preventive checkups, for preventive visits. So, these all points will tell the patient is aware about the health, about the disease, health disease and treatment. This will tell, yes, the patient will follow the medication adherence. Another is indirect subjective. Indirect subjective means we will ask the questions to the patient or we will see the diary. If the patient is making diary related with the treatment, we can see diary keeping or patient interview. Patient interview, we can ask the open ended questions and closed ended question. Like the question can be, the patient had taken a particular medication or not. So, patient will answer yes or no, and similarly there are many more questions. We'll read the difference between the open ended and the closed ended in another slide. Now, monitoring of patient and medication adherence. So, this is one of the example, Morisco medication adherence scale. This is for the antihypertensive regimen. There are some of the questions we can ask to the patient and we'll get the information actually the patient is following the medication adherence or not. So, let's see what are the questions. Point number 1, do you sometimes forget to take your high BP pills? This is a question. So, the patient forgets, we are asking the question to the patient, do you sometimes forget? So, this forget will tell this is unintentional reason. Yes, this is the unintentional reason, patient is not aware about, patient forget. So, do you sometimes forget to take your high BP pill? This could be the question for checking the medication adherence, and this is for the antihypertensive regimen. Question number 2, over the past 2 weeks, were there any days that you did not take your high BP medication? There the reasons could be unintentional or intentional. Point number 3, have you ever cut back or stopped taking your medication without telling your doctor because you felt worse? So, this you felt worse when you took it. So, there could be the fear of side effects. So, this could be the belief, this could be the intentional reasons. So, likewise there are many questions we can ask to the patient and we will get the data related with the medication adherence. So, this is all about the medication adherence, the definition part, how we will calculate, how it is important for maintaining the therapy, especially in the chronic condition and comorbid situation. So, thank you so much everyone for this session. We will meet in the next one.